All right, so today I'm going to be going over the renal Pharm part 3. This is going to be a really short video. There's only 6 drugs and 3 of them are ones that we've already learned before. So we'll start with the drugs that are for review, and that is our SGLT2 inhibitors. And so here are our drugs. In this picture, when I drew it, I thought the SGLT kind of looked like the word soldier in some way, shape, or form. So I drew like a soldier. And then you have your drug empagliflozin, which this is a frozen empanada. I mean, all of these are frozen because they all end in the word flozin. So we have a empanada for empagliflozin. We have a dirty bag for dapagliflozin, and then just a can of food for canagliflozin. So the MOA for these is that they inhibit SGLT2, which stands for sodium glucose cotransporter 2. And basically this means that you're going to spill more glucose into your urine. And so if you're spilling glucose into your urine, your adverse effects are going to be glucosuria. You're going to have an increased risk of UTIs because bacteria like the sugar that's in the urine, and then dehydration. And so we previously learned these for diabetic patients, and now we are learning that not only can they be used in diabetic patients, but patients who have kidney injury, chronic kidney disease, and it is renal protective. And so here are our 3 new drugs, and these were just called other urologic agents. And so the first one is bethanechol or urocholine. So in this picture, we have this lady here, and she says, "My name is Beth." Beth for bethanechol. And the MOA is that this is a cholinergic agonist. And so I think that's pretty easy to remember because the word chol or choline is in both the names. So cholinergic agonists stimulate the parasympathetic nervous system, and that's going to increase contractions of the detrusor muscle. And so this is going to be for patients with neurodegenerative disease. So they have a hard time eliminating urine. They already have urinary retention. And so this will, like I said, shown here with these arrows, help increase that muscle contraction. Adverse effects are diarrhea, shown here. Salivation, shown with her mouth. And then the other adverse effect is miosis, which is pinpoint pupils. So she has very tiny eyes. And those adverse effects make sense because if you think about it working on the parasympathetic nervous system, it's going to work systemically, not just on the bladder. And so it's going to cause your GI system to relax, which would be diarrhea. It's going to increase your secretions because your parasympathetic nervous system is associated with like rest and digest. You need saliva to digest. And then your eyeballs are kind of opposite. They can be pinpoint when you're at rest. So that's bethanechol. And don't use this drug with patients who have obstruction, because if they have obstruction and they can't urinate, everything's just gonna back up and gets worse. The next drug we've all heard of, it's Botox. And you can inject Botox into the bladder itself. This prevents acetylcholine release from presynaptic neurons. So that is shown here. And then it's just going to decrease the detrusor muscle activity. And so this is for patients with overactive bladder. Adverse effects are UTI. So there's a little bacteria here for UTI. Urinary retention. So there's a little droplet of urine that is still within the bladder. And then dysuria, which is painful urination or painful bladder. And that makes sense because in order to have this drug Botox, it is injected into the bladder a whole bunch of times. And so that's going to cause pain. And then last but not least, we have the drug Pentosyn. And I thought it says pent in it. And so I thought of a penthouse. So we just have a bladder that is sitting outside on a penthouse. And so the MOA is that this is structurally similar to low molecular weight heparin, and it binds to the bladder mucosa to protect the tissue from irritants. And so the reason this drug is used is because it is used for interstitial cystitis, which is a chronic condition that causes bladder pain and pressure. And so this drug is just going to somehow make the bladder mucosa less irritated. So we have a bladder here, and here in the middle is a hairpin, a bobby pin, or a hairpin, and that is heparin, like low molecular weight heparin. And adverse effects are alopecia. There's two different ways you could remember that. One, usually when you take these hairpins out, you usually rip some of your hair out. And if you don't remember that, here's a little hairball on the ground for hair loss or alopecia. And then you have diarrhea shown on here. Nausea is not shown. And then bleeding, this is just a awkward looking pile of blood. So that is all the drugs for part 3.